Now our lecture today is cystic lesion of the jaws. In this lecture, we are going to discuss the following topics: definition of cystic lesion, parts of cystic lesion, classification of cystic lesion, pathogenesis, clinical and radiological features, and diagnosis of the cystic lesion of the jaws. By definition, cystic lesion of the jaws can be defined as a hollow pathological cavity, contains fluid or semi-fluid materials, sometimes gaseous materials, and lined with epithelial lining. This is the epithelial lining and covered with connective tissue capsule. So the parts of the cystic lesion of the jaws: lumen, which is filled with or contains fluid or semi-fluid materials, lined with epithelial lining, and also covered by connective tissue capsule. Actually, the lining of the cystic lesion is very important. The importance of this lining is coming from that most of the classification of the cystic lesion depends on the epithelial lining. So if the epithelial lining or epithelial tissue of the cystic lesion is associated with tissue that is related to the tooth formation or tooth development, in this case, we can say that this cystic lesion is of odontogenic origin or related to the tooth. So the tissue that most commonly related to the tooth formation or tooth development and the cystic lesion might be arise from this tissue. These include the reduced enamel organ, whether outer or inner enamel organ within the reduced enamel organ, or outer enamel epithelium or inner enamel epithelium associated with the reduced enamel organ, or from the dental lamina, for example, or even during the root development, there is what we call Hartwig's epithelial root sheath. So sometimes after root completion, there is some cells, epithelial cells, which is called epithelial rest of molasses. Under certain circumstances, these epithelial cells, I mean epithelial rest of molasses, undergo proliferation due to certain stimulation, infection, or sometimes inflammation. So for this reason, due to proliferation of epithelial rest of molasses, this may lead to the development of cystic lesion. So in this case, this cystic lesion, since the origin of the epithelial lining associated with the tooth development, so in this case we can say that this cyst is related or odontogenic in origin. However, sometimes the epithelial lining is not related to the tissue which is associated with the tooth development or tooth formation. In this case, we can say that since there is epithelial lining and it is not related to the tooth development, in this case, we can say that this cystic lesion is of non-odontogenic origin. And also, the epithelial lining actually is considered as the main reason for, say, this cystic lesion or that this is not cystic lesion, because actually the cystic lesion, if it is lined with epithelium, in this case we can say this cystic lesion is a true cyst, since it contains epithelial lining and covered by connective tissue. So in this case we can say this is true cyst. But if the cystic lesion does not contain epithelial lining, so in this case we can say this is pseudocyst, because it contains cavity and there is connective tissue capsule and there is a fluid or semi-fluid materials or gaseous materials, but there is no epithelial lining. So in this case it is called pseudocyst. So based on this information, we can classify the cystic lesion of the jaw into odontogenic or non-odontogenic. The odontogenic can be further classified into developmental, that means the initiation stage, what we discussed later on, due to developmental within the tooth development, or due to inflammatory, due to infection. So this will lead to the what we call initiation, or what we call due to inflammation. For example, inflammatory, that means there is inflammation or infection. This stimulates the epithelial tissue of, or which is related to the tooth structure, stimulation of these epithelial cells. This will lead to the, or this cause formation of the odontogenic cyst. So odontogenic or non-odontogenic, odontogenic of developmental origin or inflammatory. Non-odontogenic could be there is also epithelial lining, but the epithelial lining not related to the tooth formation or tooth development, such as the nasopalatine duct cyst or nasolabial cyst or globulomaxillary cyst. Another classification, actually, we can say, as I mentioned before, the classification based on the presence or absence of the epithelial lining into true cyst, which contains epithelial lining, or pseudocyst, which does not contain epithelial lining, such as simple bone cyst or aneurysmal bone cyst. Actually, this classification of the cystic lesion of the jaws, that means intraosseous, within bone of the jaws, I mean the maxilla and the mandible. In the oral and peroral region, there is soft tissue and bone. Sometimes cystic lesion may develop within the soft tissue. So in this case, we can say this is soft tissue cyst. For example, ranular or mucosal. These are soft tissue cysts. While what we discuss now, this is cystic lesion of the jaws. The pathogenesis, in general, there are two stages for the cystic formation: initiation and enlargement or expansion. In case of initiation, it is different. Actually, this stage is different among the different type of the cystic lesion of the jaws. That means the development or the formation of the periapical cyst is different from that of the what we call keratocyst or dentigerous cyst or eruption cyst. So initiation is different from one cyst to another. While in the case of enlargement or expansion, it is similar among the cystic lesion of the jaws. So for example, here we can see this is the initiation stage of the inflammatory cyst. For example, periapical cyst or radicular cyst, or what we call even residual cyst, because residual, that means after tooth extraction, the cyst remains within the jaw, and this is called residual cyst. So here, due to infection, I mean pulp infection, the infection spread to the periapical tissue. And since there is defense mechanism, this will lead to the formation of periapical granuloma. But due to chronic infection and stimulation of the epithelial rest of molasses here within the root, this will lead to proliferation, increase the rate of proliferation of epithelial rest of molasses. So the central region of the periapical granuloma, since it becomes away from the blood vessel, it undergoes necrosis, and this will lead to cavity, and subsequently it will lead to periapical or radicular cyst. So this cyst, periapical cyst or radicular cyst, occurs due to infection, due to inflammation. For this reason, it is called inflammatory. While in case of keratocyst or dentigerous cyst or eruption cyst, these cystic lesions can be developed not due to infection or inflammation. So for this reason, they are said developmental. That means within development of the tooth, the cystic lesion can be developed. In case of enlargement, actually, as I said before, this stage could be similar between or among all of the cystic lesion of the jaw. But there are different theories explaining the enlargement or expansion of the cystic lesion. One of these theories said that due to an increase in the proliferation of the epithelial cells of the lining, this will lead to an increase in the surface area, and this will lead to, or subsequently it will lead to expansion or enlargement of the cystic lesion. Other theories said that it is due to an increase in the intracystic pressure, due to an increase or hydrostatic pressure, an increase in fluid or material within the cystic lesion. This called an increase in the intracystic pressure. Or some people said that due to an increase in the osmotic pressure also, and another people say that the connective tissue capsule surrounding the cystic lesion secretes certain substances, cytokines or interleukins, and this activates the osteoclastic cells, which lead to bone resorption and expansion or enlargement of the cystic lesion. So actually, there are many theories explain the enlargement or expansion of the cystic lesion of the jaw. Now, what are the sinus symptoms? How we can diagnose this cystic lesion? The most important thing that cystic lesion, we have to know, or we must know, that the cystic lesion does not contain pus. So for this reason, cystic lesion is painless swelling. But since once it is infected, it will give what we call, it will give a painful swelling. So it is painless swelling.